Ravina, your stream is live now, and I have also make you the host back.
All right, thanks. Did you want to be co-host or just you're fine where you are?
No, I will be in the class for like 10 minutes, so it's all fine for me.
Okay, no problem. Hello, good morning or afternoon. Good afternoon, probably for most people. Hi, Arthur, and Diane's here.
And good morning, or good afternoon.
Yeah, where are you coming in from, Arthur?
Michigan.
Oh, okay, nice.
So it is afternoon.
Yeah, it's only 10:30 where I am, but
Okay.
yeah, 10:30. I'm in Pacific time.
Okay.
Yeah. But this is my last class to teach today, and then I'm going to go and enjoy the sunshine outside. All right. Hi, Cindy. Nice to see you. And Joyce is here. Great to see everybody. I'll just ask you, everybody, just to mute themselves. Just while we're, if you're not speaking, we'll mute ourselves, and then it'll be easier for everybody to hear. There we go. Yeah, that just makes it a little bit easier. We don't hear the outside noise unless you want to say something. Then I love when you take yourself off of mute so that we can hear each other. All right. I'm gonna open my chat box so that I have that on the side here so that I can see if anybody puts anything in the chat. So for anybody, if you're having any technical issues, first thing here, please just raise your hand, or Todd's in the class for the first few minutes just to help out if anybody's having any technical issues. He won't be here for the whole entire time, but he will be here definitely in the beginning here just to see if anybody needs anything. And if you want to put your camera on, that's kind of nice. I love to see people, so I know who I'm connecting with. I will get my screen shared now for all of you. So let's just make sure we're in the right spot. There's so many classes now you can take at Get Set Up. So sometimes, I don't know if I've ever made it to the wrong class, but sometimes I'm thinking it's going to be something and it's something else. So I created this course just a few weeks back, kind of because I was sort of thinking about what else could we learn about in terms of health for ourselves. We're all getting good at brain health. We're learning about new class on arthritis management and relief from arthritic pain. I just completed a class on diabetes and how to reverse our diabetes. Yay. That will be coming out hopefully in another week or so. And with all the stuff I was studying, I thought we don't have anything for the eyes, and eyes are kind of like the heart. And which I mean is we take it for granted. We take our hearts for granted that it's just gonna keep beating until we don't need it anymore. And I think we do the same with our eyes, unless you've had an eye issue, and then you realize, oh, I got to take care of my eyes, because if I were to lose eyesight in one eye, that would be really devastating to me. Oh, is that right? Yes, Cindy. Yes, that's right. I see you've got your little patch on. Or where did you go? Did you leave? Where did Cindy go? Oh, there she is. There. You moved on the screen for me. Yes. So you just had eye surgery. Interesting. Do you want to tell us what you actually had? Was it for an infection, or was it we're going to talk about a few different eye diseases that are familiar, common. There you are.
My internet is really slow, so I don't know if I'll come through very well, but I had a lens. Okay, good. I had the second lens put into my eye and it slipped.
Okay.
And so they had to go in. This is the fourth surgery I've had on this eye. So they put a brand new lens in, but they had to connect it to the white of my eye this time. So
okay. All right. Well, we won't freak everybody out that I'll just put you back on mute there. We won't freak everybody out that will think that it's not a good surgery, because we will talk a little bit. I'm assuming that was for cataracts. Yeah, for cataract surgery, when they take the lens out. Yeah, so we'll get into that a little bit in the class. So not to worry, everybody. We're going to be good. So optimal health, eye health. And my name is Ravina. For any of you I haven't met, I don't know if I met you, Arthur. I'm not sure if I've seen you in a class before, but maybe. I mean, I recognize Cheryl. I recognize a bunch of other ones. Nelda's here again, and Diane I've seen before. But anyways, hello to anybody who's brand new to me, or even brand new to Get Set Up. I've been involved with health and wellness my whole entire life. I love it. I love to teach it. I love to mentor in it. I work as a health and life coach outside of Get Set Up. This is what I do. I'm in my 50s. I'm trying to reverse time for me. So I'm hoping to look like I'm in my 40s in the next, 6 months as I get myself in better shape. Yeah, that's okay. I think early 40s would be kind of a nice age to sort of stay at. I don't need to go back to my 20s, I don't think. So anyways, I'm all about prevention. All of my classes will focus on some form of nutrition, because I feel, just like Dr. Mark Hyman, that as a functional nutritionist, that nutrition is the center of our healthcare. If we can use nutrition, why not? It's probably one of the cheaper things to use. Even if we're buying organic foods, it's cheaper than buying medication and going for surgeries and having all these problems where we can't move and we can't, we need someone to clean our house and all this stuff because we're ill. So this, as I mentioned, eyes are a little bit of an underrated thing, kind of like our hearts. We don't think about them that much until something goes wrong. So we do learn from each other. So I love that you guys, a lot of you have your cameras on. If you can put your camera on, you're not in your PJs and feeling like you don't want to be seen, just throw the camera on just for a few minutes if you can. We are recording the class, so you can ask for a recording at the end, and we are live streaming this particular class. I tend to get live streamed a lot. They pick and choose which ones they want, and I do believe, because I cover health and wellness, we can all of us would most likely like to have better health. So they do tend to live stream my classes. There are some of the fitness classes they live stream quite a bit, because they're so full, they want to reach more people. And we also, just a reminder, we don't get paid any kickbacks or money for any products or services that we might talk about today. So we got a lot on the agenda. I feel like we'll have enough time to get through it if I don't go off on too many tangents, and I'll try not to do that. But I do like to hear from you. So if you've got a pertinent story or statement or question to ask, just use the electronic hand if you can in the reactions button down below. Give us a clap or a thumbs up if you agree on something. I love that. That just makes me feel like we're all in the same room together. 7 ways that our eyes change as we age. Very important for all of my classes. I like to really pinpoint what is different for a 50-year-old and older, in terms of whatever topic I'm talking about. Often, if you were in my Detox Your Home class just an hour ago, we talked about how a lot of the information that's out there targets families and children, not us older ones. And so often when we're reading material on the internet, and let's face it, most of us do some kind of Googling on, or searching on the internet for information. Often it's targeted for the families and the kids. So I want to know what changes for my eyes as I'm 50-something-year-old and getting older. What changes can I expect might happen with my eyes? We're going to understand top 4 diseases that occur commonly with us, 8 ways to improve our eye health, and then top 10 foods for optimal eye health. And just so you're aware, I have a handout that will have the top 10 foods, so you'll get it in the post email from me, and then you can print that handout and put it on your fridge or put it somewhere for a reminder about these foods that you can eat to improve your eye health. Did you know you can actually improve your eye, the strength in your eyes, and improve your eyesight? Actually, you can reverse some of the bad eyesight you have from doing some of these things, by giving your body what it needs, the nutrients it needs. You can actually improve your eyesight. Isn't that good news? I'm happy to hear that. All right, let's get going. So Does anybody know at what age your eyes actually stop growing? It's just kind of a fun little trivia thing I like to throw out there, because I didn't even think about it. Don't they say, is it our nose or our ears? Do our ears keep growing forever? Like, so that's why we end up with bigger ears?
Yes.
I think I
that's
heard that
what they
about
say.
I think I heard that about the ears. All right. Well, maybe, maybe my ears are still growing. I'm not sure. All right. So when do the eyes stop growing? Actually, so when we're babies, it takes about 2 years from when we're born to 2 years old for our eyesight to fully develop. And anybody who has had children, I have not had children, but I was a kid at one point. When we see a baby, their eyes change and develop. It takes about 2 years. So babies don't always see that great, or their eye color actually changes over the first so many months. So when a baby's born, that might not be their eye color. It's really interesting how the eyes really ramp up. And then your eyes rapidly grow from birth up till about puberty, which is around age 20, 21. Around then your eyes stop growing. Interesting, isn't it? But then your eye, the size of it stops growing. Like, I don't think I have an eye this big, but your eye size stops growing around 20, 21, 22 in there. But then your eye continues to increase in weight. Isn't that neat? And it will undergo age-related changes throughout your life. So around 21, the size stops, and then it starts to take on some weight. And then there's some things that shift and change as we age. And of course, I'm going to say this being a holistic nutritionist, depending on how well we take care of our body, it will determine how healthy our eyes are. I thought this little guy here, girl or guy, I can't, maybe it's a girl, it's got nice eyelashes, has such big, beautiful eyes. But I think it's kind of like, I have this picture of my little cat. I mean, just to take a little segue. And he's got these huge eyes and he's got these huge ears, and he's this tiny little cat. Next time I'll bring the picture. It took him a while to grow into his eyes and his ears, because as his body grew, then he kind of grew into the size of his eyes and his ears. And so in humans, it's sort of similar. All right. So can anyone guess, thinking about us around, older ages, what is the most common age-related change we have with our vision? Anybody guess? Arthur, you want to shout it out? Oh, you got to take yourself off of mute, or you can type it in the chat. Oh, you're still on mute there. It's a funny button.
I have one.
Sure.
We require more light, external light. So I think maybe the iris gets smaller.
Okay. And Nelda's saying she thinks at 30, she was saying before. Joyce is saying dry eyes. Yeah, that's all good. Can you get the mute off? It's usually the little microphone button down at the very bottom on the left-hand side of your screen. No, it's not working. Okay. If you want to, can you type it into the chat? Try that, see if that works. No? Okay, no worries. Well, you'll see what the answer is. And if you're right, Arthur, you give us a thumbs up and tell us that you got it right. All right. So, and Joyce is talking about cataracts and glycoma. Okay, so here it is. Dun, 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 dun. It's called presbyopia. Presbyopia. That's the complicated thing for not being able to see things close up. Now, does that make sense? It makes sense, right? And actually around 40, and if you are unlucky, it will happen even sooner than 40. You start to have problems seeing things close up. You kind of go like this with your eyes, does anybody do that? And then they start moving their paper a little bit further away and a little bit further away, and it gets clearer and clearer because that's close up is very difficult. That is the most common thing. If you talk to your eye doctor, will say is being unable to focus as well on an object close up. And why is that? It is because the lens inside your eye begins to sort of lose its ability to change its shape as quick as before, and it gets stiffer. And so that's where we get this presbyopia, which is the fancy term for not being able to see close up. I can never get them. When somebody would ask me, you know, what is it that I have? Like, I've always had not great eyes for distance. So that's the opposite of presbyopia. But I mean, I'm not going to get into fancy stuff today. I just want to get to the chase and the interesting things. So what do? We start compensating for the fact that we can't read our book, you know, our paper this close. We start putting the paper further and further away. Like, this girl looks fairly young, I suppose. She's reading her book, but she would start to move the paper. And, you know, and it's a joke, like, it's like, your arm's not long enough to read, get your reading glasses, right? We say that to people when we see them doing that, like stretching their arms out. And then, so a lot of us will have reading glasses by our desk, do we not? And do we not have an average about 3 pairs? Right? Because we always lose them. Sometimes we've got these fancy little things that we can put them around our neck, but we still lose them. Now, I'm lucky, I will say this. I've been following my own advice for a while with eyes. I'm 56 this year, and I guess what? I don't really use these. These are my brother's hand-me-downs. He gave me about, I don't know, 4 pairs of glasses that are not strong enough for him anymore. These are reading glasses, and I rarely put these on, but I'll tell you when I do in a sec. But most of the time, I'm still okay. I can read close up. So not
Where do you want to eat your breakfast?
Yeah, I'm not bragging about it, but the fact is I've never had great eyes for distance. My whole like since grade 1, I never had really great eyes for distance. So let's keep moving along here. So what's another thing that happens as we age? This is one that can happen. We end up having tearing in our eyes. Has anybody experienced that? That can be a side effect of medication. It can be just having sensitivity now to light, wind, and this is the key, temperature change. I had a learner in the class last week, and she said for some reason before she went to bed, she would get this tearing in her eyes. And we determined from just talking about it a little bit that it might have been because of the temperature change, because she keeps her bedroom cool, which is good, a great idea for going to sleep. Keeping your bedroom cool is a great way to get a good night's sleep. So the temperature change from the cozy living room to the bedroom would cause your eye to tear, or one or the other, sometimes both. Protecting your eyes is really important. So if you're going to go outside, and we'll get to the reason why it's even more important as we age, you know, I don't laugh at those guys and women and men that wear the sunglasses that have the protection around the side. I used to kind of look and go, what are they doing? Did they just have eye surgery? No, they were protecting their eyes. Good for them. If you have tearing that persists, I would suggest that you go see the doctor, go see your eye doctor, because that might mean that there could be a little bit of an infection, and it could be blocking the tear duct. And we need the tear duct. Why? To kind of, if our eye does water, the duct is there to help with that. So if we have an infection of the tear duct, it could also cause our eyes to tear. But this is something that can happen. Now, if it hasn't happened to you and you're the opposite, you have dry eyes, fine, that's fine. But this is something that can happen as a side effect of medication. And this happened to my father. All of a sudden, he was only one eye, not the other. He was getting this tearing in his eye, and it bugged him. And it turned out it was his medication. Here's the one that Joyce had mentioned, the dry eyes. Anybody get dry eyes? Yeah, that's a big one for us older adults. Dry eyes, it's basically your tear glands are not making enough tears. And that could be for many reasons. Hormonal changes, especially us women in menopause, things sort of tend to dry up a little bit. It can be uncomfortable. It can burn. It can scratch. Like if your eyes or when my eyes are dry, I feel almost like when I used to have contacts in my eyes and it used to scratch my eye. We forget, you know, you can get natural teardrops, like not medication, but just like natural tears. I used to think, oh, I don't want to get addicted to it because then my eyes won't produce enough tears. That is a myth. It's a myth. If you've got dry eyes, ask your doctor for some form of a natural eye teardrop that you can put in your eyes, and how soothing does it feel when your eyes aren't dry. The other thing you can do, if you live in Phoenix or Arizona or any kind of state that has dry air, a humidifier is amazing to put some moisture back into your air. Every day you're in dryness, put some moisture back into your air. Humidifiers are not that expensive. That I'm not talking about air purifier, which I just talked about in the detox class for homes. A humidifier are those little kind of cutesy little things we used to put in our baby's room, you know, for the babies, to add moisture into the air so that they could breathe. Because, you know, little young kids can't spit or cough up. They don't know how to do that, right? If they've got phlegm in their, like as adults, we learn how to bring up if we've got phlegm in our throats, but our young children don't know how to do that yet. So that's why we put humidifiers in their rooms. So those are fairly inexpensive humidifiers versus like the air purifier, like a Dyson air purifier is $700. The other thing is if worst case scenario and you just can't think of something, you could even put bowls and put water in bowls around your home, and it will take up this moisture into the air. That's a simple, really free way of doing it. All right. So I'm not going to try to, well, no, I'm not even going to try, but dry eyes, that is up on the screen. That is the formal word for it. I tried it last week and I butchered it. So I'll leave that. All right. How many of us, and I have this, have floaters or flashers that happen in their eyesight? Yeah. And it's kind of weird. If you sort of go into that peripheral sort of stare, you can see the little floater things kind of maybe floating past your eyes or floating down. That is kind of normal to have that. All right. However, I will say that if you're noticing an increase in them and it's kind of bugging you, it's almost bothering your vision, not to scare you, but it could be a sign of like a retinal detachment. And the retina is in the back of our eye. And sometimes through some sort of damage, we can have a retinal to detach from where it's supposed to be. And you most likely will get these like bloom, like these light flashes that flash in front of your eyes. I had never had those until I had my LASIK surgery, which I had 3-4 years ago now, where I had, because of my distance, I had my eyes LASIK. It's a simple surgery. And now I don't wear glasses or contacts. Yay for me. Because I used to scratch my eyeball with my contacts because I wasn't the best at keeping them absolutely 100% clean. I don't know. I used to get a bit lazy, but I'd had contacts for 25 years. I wore contacts, long time. And it's not great because if it's not clean, you can scratch your eyeball. If you think there is any big changes with your eye, please go to your eye doctor. I don't know if you need a referral. I think you can just go right to your eye doctor. So please, if the floaters have changed in some significant way, get your eyes checked. Now, who was it? Let me see if I can remember here. Was it Laura? It was Laura that was talking about pupil size and needing more light. Interesting subject. So the muscles that control our pupil size, the reaction to light in us older adults starts to reduce. Now, has anybody taken just my regular basic nutrition class? I think I've seen a few of you in there, maybe. Remember, I talk about as we age, we just tend to normally reduce muscle mass in our bodies. From age 30, after age 30, it's kind of downhill when it comes to holding on to our muscle mass. So what do we need to do? We need to do our strength training to keep our muscles going, because if we have less muscle mass, we need less calories, therefore we're less hungry. Now, that's okay, but we don't want to lose our muscle mass because we need our muscle mass. And in that class, I talked about muscle mass in our jaw. So we start to have problems chewing our food when our muscle mass decreases. The same thing here for our eyes. The muscles that control our eyes, we're losing some muscle mass, so we're not changing our pupils very well. So we actually have the smaller pupil. What does that mean to us? Because that's like, what's the result? That's what we really want to know.
We need more light.
We need more light. When you're 60, you need 3 times more light than your 20-year-old kid. And that's why when you see a 20-year-old or a younger kid reading their book, it seems like they're reading in pitch dark. We see them in the living room when we yell at them and say, put the light on, you're going to ruin your eyes. I can hear my mother saying that. You're going to ruin your eyes, put more light on. And we would just be adamant that they couldn't see. And they're just like, what are you talking about? I'm told I'm great. I can see, no problem. I have no problem. There's still light outside coming in through the window. We need 3 times the amount. So to comfortably read, you know, sometimes we awkwardly try to read and it's like getting too dark. Wintertime is terrible for it, right? We don't get enough natural light, so it's hard to read in the winter. I have a friend who just doesn't read in the winter because she hates not being able to see properly. The other thing, okay, sorry, go ahead, Bob.
And I thought that the need for more light was related to cataracts, that your lens was clouding. We were about to talk about that.
Yeah, we're going to get into some of the diseases, but just naturally, because of our muscle mass changing, we need more light. And absolutely with cataracts, we do too, because the lens is getting cloudier and it's affecting our vision. So we're going to get to that in just a sec. But just generally, as our eyes age, we will have a little bit less muscle control of our pupil. The other thing that means, what does that affect? The light sensitivity. So as an older adult, even if it's like a dull kind of a glary day with clouds, do we not need our sunglasses? Oh my gosh, I go outside and I'm like this. It's like, oh, I can't even see. I need my sunglasses till my eyes adjust. It takes longer for our eyes to adjust. So that dazzly thing from the bright sunlight and the glare, when we emerge from being inside to outside, that is why it's different. You might think, geez, I don't remember that like that when I was 20. When you were 20, you just ran outside, or 15 or whatever, and no problem. You didn't see 15-year-olds running around with sunglasses on. We don't really see it, right? Because their eyes are so much stronger than ours in terms of reacting, right? Of course, we want our 15-year-old and our 10-year-old to wear sunglasses because we don't want them to get damaged from the UV light, because then that can cause problems later on in life. But that's another story. You might have grandkids or younger kids still that are not taking care of their eyes, and you can say to them, hey man, take care of your eyes now, because you'll thank me later on in life. Okay, here's another one. I wasn't happy about this one. I consider myself a good driver. When I'm driving, I'm often looking in the rearview mirror to see what's going on. I'm somebody who doesn't have my music blasting, so if the ambulance starts going, I hear it right away. I'm probably the first car to pull over to the side because I can hear and see the ambulance coming down the road. However, unfortunately, as we age, our peripheral vision, so you know, we look forward, this side stuff that we can see, like right now I can still see my hand. I can still see my hand kind of back here. But as we age, the peripheral vision shortens. So maybe in 10 years, like right now I can still see my hand where it is. But as I age, maybe I can't see my hand here. I need it to be a little bit here. Where is it the most important to know to have peripheral vision?
Driving.
When we're driving.
Driving.
Yes, driving. So we actually lose around 1 to 3 degrees of every 10 years. So like, thank goodness it's slow, right? You know, you don't want to wake up one day on your 60th birthday and it's like, oh gosh, I can't even see over here now. That would be awful. It's very, very subtle, and you might not even notice. But if you have been driving for 40, 50 years, go do a little test. Go sit in the car and go, okay, I don't remember having to move my whole head, but that's what I want you to start doing. So if you've got any kind of neck mobility issues, range of motion, go to the physio, get the massage, do what you need to do to strengthen your neck muscles so you can actually take your head and move your head. You know, if you can't move your head without moving your body, when you're driving, be very careful. Make sure you move your whole body to look. Do your checks. Well, what's the check we do? We go left? No, what is it? We do right, left, right, or whatever it is, depending on which way you're turning. So our eye peripheral vision changes as we age. So just remember that one. That one's one that we don't even think about. All right, here's something. Oh, I found this so super interesting. Because our retina, the thing in the back of our eye, is responsible for color, the colors that we see. As we get older, the sensitivity, our sensitivity changes. It decreases slightly. Just like in the nutrition class, I talk about our smell and our taste sensitivity decreases a little bit as we age. I mean, it's not to say old age is, or older age is like all downhill, but it's just good to be aware of these things. We might not be able to really differentiate between colors. Now the screen, the thing I have vision, you know, those are all different colors up on the screen, the purple, blue, orange, yellow, bright green, and sort of a turquoisey blue. That's what's up on the screen. There are some people that are born colorblind with, say, blues and greens. That's a common one. So they can't be electricians. I mean, that's one job they can't do because it can't see the different color wires. And that's a test that they check for. And it's more common in males to have color blindness than
Women.
Yeah,
Females.
than women. It's more common in men. And so that's why they really have to for electrical work for sure. I don't know, Laura, if there's probably a test for peripheral vision. When you go to get your eyes checked, if you go once a year or once every 2 years, I think your doctor does this, you know, he goes like, you know, the eye doctor does some different things. You could probably say, can you check my peripheral vision? Has it changed? But just getting back to colors, we have a less sensitivity, so we might not be able to to know the different colors. Guess what is the biggest thing? Blue. Have you noticed this? I have not noticed this yet, but blue, the color blue might look more washed out to you than when you were younger. Isn't that fascinating? It might just seem sort of more washed out. Now, we always joke, my mom and dad, when my mom was alive, we used to joke that my dad was colorblind because they inevitably get ready for church. He'd put his suit on. He's got a dark green suit and he's got a tie that doesn't match at all. And my mom would say, go back, you know, or she'd pick out his tie for him because he couldn't really differentiate the colors that well. So keep this in mind if you're an artist, if you are a seamstress, if say you are an electrician, as we age, the color discrimination can be a little bit harder for us. So something that might have looked really green to us, we might be having to think about it for a second. Is that green or is it slightly blue? I'm always arguing with my husband on color, but he seems to think he's got the color down, right down pat. What else did I think about with colors? Yeah, I think the blue and the green is one of the bigger ones. Absolutely, that can be harder to distinguish. And I find it interesting if anybody's got pets. I always like to know about, don't cats and dogs, I don't know if they see all the colors, do they? Who's a pet
I don't think
lover here?
so.
I think they only see the gray shades possibly. I'm not sure. I'd like to find that out. That would be like a fact I'd like to know. Like, do cats see color? Can they see blues and greens and stuff? I don't know. I think they've got really good sense of, oh, I'm freezing there for a second. Can you guys still hear me okay? It could be mine. Yeah.
Yes.
I just see me some. Oh, there we go. Cats have such a keen sense of smell that they don't need to see the color of the wet food. They just know you open, or they hear the can opening. They know that the wet food's coming. That their treat. If they eat mostly dry food. All right, let's not digress. All right, let's look at by age 65, 1 in 3 Americans, probably similar for Canadians, will have some form of vision impairing eye condition. 1 in 3. And here are the 4 types: cataracts, glycoma, macular degeneration, and diabetic retinopathy. Those are the top 4. And it's interesting because cataracts, we'll talk about cataracts now. Cataracts are so common that we think it's actually part of becoming an older adult. And even though they're not, but we kind of classify them as a normal aging change. Isn't that awful that this disease, we have to actually say, oh, that's part of normal aging. It's kind of like dementia. If you've taken my brain course, it is not part of normal aging. It's just that it's kind of common. So the thing about cataracts is the Mayo Clinic, which you've heard of, the Mayo Clinic, says that 50% of 65-year-olds have some degree of cataract formation in their eyes. And Bob brought this up. It's that cloudiness that comes over our lens. We get a bit of cloudiness. Now, at first, it's not going to affect your eyesight. But as it gets milkier and cloudier, it will start to affect your eyesight. So if you are seeing your eye specialist, eye doctor regularly, they test and they check to see how cloudy is your eye. Now, they're not going to say, let's have surgery, do surgery right away. But as it develops onto your eye lens, it will start to affect your eyesight. Not at first. At first, cataracts have zero symptoms. You don't even notice. So, you know, I am bad. I will say I have not been to the eye doctor in about 4 years. Terrible, terrible, I know. I need to go. I should go. But here's the thing. Now, where's Cindy? Cindy might be the anomaly here, but on average, cataract surgery is, first of all, it's extremely safe and it's so effective that they have been able to give you 100% of your vision loss back once you get cataract surgery. What do they do in cataract surgery? Cindy could probably teach this, because they go in and they remove that cloudy lens that's gotten too cloudy, and they actually put in a fake, you know, whatever it is, like, I don't know what it's made out of actually, because I don't know, maybe Cindy knows, but they put in a new lens, and it's like waking up and going, oh, like you're not under, they don't put you under, I don't think, with cataract surgery. Do they put you under? They do they? With LASIK, they didn't put me under. I was just like lying there awake, and I was a little bit nervous, but they put all these contraptions on your eye, so you literally can't move your eye.
Yeah, I had the cataract surgery, and I had the 3 lenses put in my eye.
Oh, okay.
Yeah, so that I can see, but as you can see, I'm wearing glasses because, in fact, I have an appointment with them because I am not satisfied. I mean, it was like thousands and thousands and thousands of dollars, and I'm not satisfied because these are Walmart glasses that I was supposed to use just for seeing close until my eyes get really, you know, adjusted. But I mean, I can keep them on, and it doesn't make that much difference to look far as it is, or look at my computer as it does to read.
Right.
So, anyway.
Well, good comments. Thank you for sharing those things. So what I want to say to all of you is, well, first of all, you know, good on these ophthalmologists, the surgical eye doctors. They make a fortune, by the way. My friend works in ophthalmology. He's a nurse. Him and his wife are both nurses, and he works in ophthalmology at our local hospital. He says to me, he goes, Ravina, they make a fortune, these guys. They come in and do LASIK surgery one after the other. Like, what, you're in and out in half an hour or less, because they do one eye, the other eye. It's like a factory almost. I mean, these guys are professionals. Don't get me wrong. They went to school for a long, long time. But compared to the specialist that takes your tonsils out, these guys, eye specialists, make a killing. So if you are not happy with the result of your thing, get a revision. Go and say, hey man, I don't have that 20/20 vision you promised me, or that 10/20 vision, or, you know, or what, no, sorry, whatever the better vision is from 20/20. If you're not satisfied, now in Cindy's case, obviously something happened with the lens that started to slip. And that, I guess, is something that can happen, but don't get discouraged. If you need cataract surgery, like my father-in-law just got it done. I think they do one eye at a time when it comes to cataracts. With LASIK for vision, they just do it at the same time. I didn't like that they did it at the same time. But anyways, that's about it about cataracts. We have a solution. It is surgery, but it's pretty much not terrible. Cindy, you're on. Did you want to ask us a question, Cindy?
I just wanted to say I've had I had problems with one eye. The other, I've had this lens in there for 10 years. It was wonderful surgery, didn't have a problem.
Okay.
So this was just an anomaly and very rare.
Okay, good to know. Good to know. So
yeah, I had cataract surgery 3 years ago, and they did one eye, and then I waited 2 weeks and did the other one. And I was back at work the next day after each one.
Yeah, isn't that amazing? I find it so fascinating that they can do it. So don't be scared. Some people are like grossed out with the eyes, like they could never wear contacts. I was constantly touching my eyeball because I had contacts for like 20 some years. So don't be afraid, because cataract surgery is super, super safe. Bob?
And my wife had a special kind of lens put in. There are various different kind of lenses depending on the kind of vision that you have. So she got some more expensive, more special kind of vision. But
she can
my
see.
eye doctor is saying that I'm not ready for cataract surgery. They have to ripen yet.
Yeah.
More.
Yeah.
What does that mean? What does it
Well,
mean by saying
basically, it's like
ripen?
any, yeah, you know what that means? I mean,
No.
I laugh because as a nurse specialist, it's like, that's why I'm in prevention. That's why I do prevention, because the doctors, the vascular surgeons that see your circulation, or the eye doctor, when you come to see it, your situation's not bad enough, Bob. That's why he doesn't want to do it. They want it to ripen. They want it to get worse. This is what these doctors, specialists do.
That I understand, but it sounds like it's a fruit needing to ripen.
I know. It's like old age, right? As we age, it's going to ripen. I don't know. It's kind of a weird term to say, but you know, the vascular surgeons, oh, sir, yep, your circulation's not bad enough. Come and see me when it gets worse. Bye-bye. Like, isn't that weird that couldn't the vascular surgeon guy say, you know what? You're doing pretty good. Keep doing what you're doing. Improve your nutrition so you don't have to ever come and see me. That's what you want to hear from these doctors. All right.
I don't have a problem with color, but I do have a problem with night vision. You didn't mention night vision.
Yes.
I think that's related to cataract.
Yes, night vision, absolutely, because again, the lens is having troubles adjusting quickly. So when I talked about pupils and having brightness when you go outside, I could actually add that to the slide, but thank you for that. What are the causes of cataracts? Diabetes. Oh my gosh, diabetes can cause you to have cataracts. Trauma to your eye. Some medications can affect cause the cloudiness in your lens, and also excessive UV light exposure. So if you were young and you're always outside sun tanning, and or when they say, when we have these things, eclipses in the sky, and they say, please protect your eye, do not look directly at the sun. We should never look directly at the sun, ever. Okay, let's move on. Glycoma. This refers to a group of diseases that causes pressure in our eyeball. Now, in the early stages, no symptoms. This one's a scary one. In time, the pressure and glaucoma can cause damage to your vision permanently. So if you are not going to see the eye doctor, get your eyes checked. Progression of glaucoma goes so slow that you don't even notice till it's too late. So with glaucoma, it's not the same as with cataracts where you can just get your lens replaced. Glaucoma can cause permanent damage. So think of your eye as a tire. It has to have a certain amount of pressure so you can see properly. It's okay to have that certain amount of pressure, but when it goes over what it should be, that's when the damage can happen. And if it stays like that, you damage your eye. Family history is you can have hereditary with glaucoma. Older adults, unfortunately, we're at higher risk, and African American people are at higher risk of glaucoma. So get your eyes checked. Everybody, we should all get our eyes checked. I'm not sure with my heritage if that's a higher risk, but when I was studying this, it did specifically mention African American folks. So I don't know about other culture or other backgrounds, but I think for everyone that's an older adult, you are now in that higher risk. The next one is macular degeneration. This is a bit of a mouthful, but basically what that is the back of your eye where your retina is, there's a part of it that's called the macula. And what happens is the macula of that retina starts to break down. This one is what's necessary for the images that we see, like for the images to be collected and sent to our brain to say that's what you're looking at. So when you have macular degeneration, you're losing your eyesight. You want early diagnosis for this too. It usually develops around age 60. That's common, kind of more common around age 60. So again, it's the back of the eye, the little part that collects the images that you're seeing and sends it to your brain. So it's a quick thing. So when you're looking at something, that's what it's sending to your brain. The last one is diabetic retinopathy, another mouthful. What does that mean? If you have diabetes, it means you've got sugar problems in your blood. The insulin that was released from your pancreas is not good enough at getting the glucose out of your blood fast enough. Your body is not sensitive to your insulin release anymore because you're having too much sugar, possibly. You're dumping sugar into your body over and over. You're eating bread every day. You're eating sweets every day. Your insulin, your pancreas can't pump enough insulin to get rid of the glucose, and now your body's kind of like tolerant to it, and it doesn't work anymore. It's not sensitive to the insulin, so the glucose stays in the blood. If the glucose stays in the blood, it goes up to your brain, it goes to your eyes, and the little vessels in the back of your eye get damaged from diabetes, which causes retinopathy. And what does that mean? You start to lose your vision. If you have diabetes, you might have really not good vision, especially at night. So Bob had mentioned the at night thing. You can have poor vision at night when you have diabetes because of the retinopathy. So it says here, it causes leaking and growth where it shouldn't be on the little vessels in the background. And with you have consistent high blood pressure and high glucose sugar or glucose in your blood can cause diabetes, diabetic retinopathy. So if you don't even know you have diabetes, you know, something to get tested. So what can we do for our health? This is what we can do. Please start wearing glasses. Okay, Robin wants to know about macular degeneration. Well, we're going to get to the number one thing, Robin, you can do for worrying about macular degeneration is take care of your eyes. All these things up on the screen will help you to be at less a risk of macular degeneration. Also, we're going to talk about the foods that I want you to eat to keep your eyes healthy. It's one of those diseases, you want to get it caught early. So regular eye checkups is what's going to stop this. And there's two different types of macular degeneration. I didn't get into it. One goes rapid and you can end up having vision loss completely. The other one's a bit slower. All right. Wearing your sunglasses outside. I have 3 pairs of sunglasses in my house. I've got one in the car. I've got one in my purse. Always have sunglasses handy, because if you forget and you're going to go out for that little walk to the grocery store and you think you're going to be okay, you probably are not going to be okay. You're going to have a hard time. You're putting strain on your eyes. Don't strain your eyes. That comes to the next thing. Rest your eyes. After doing a class like Get Set Up and you're in front of the computer, take a break, close your computer, go, you know, move yourself around. The best thing you can do for your eyes, and I don't have it up on the screen here, when you're staring at the screen, you're looking at me, you're looking at the rest of us, take moments where you look away. Take a moment where you stop from the screen and just look at the ground or look out the window. Change the view for your eyes. That's the number one thing you can do. If you have to sit at the computer because you're studying or you're doing something, take a second, you know, every couple minutes, take a second, look outside, change what you're looking at. Don't stare at your screens the whole time. Just general movement, keeping yourself healthy, also keeps your eyes healthy. So getting some movement in, moving around, you know, do a few arm exercises while you're sitting here watching the class. Like, it's not going to bother me if you're moving around a little bit. Smoking, oh, horrible for your eyes. Did you know that? Smoking is actually bad on your lungs, but it's really bad for your eyes. Getting a good night's sleep is important. Washing your hands. Guess what? We've learned now how to wash our hands properly because of COVID. I never washed my hands that long before. I'm washing the sides, I'm washing between, like, you know, as a nurse, we learned how to do that, right? When we did the test in nursing, we had to wash our hands and then we had to put it up to the light and see what we missed. This is the part we miss. We miss this part of our hand a lot of the times. So that's why, you know, surgeons, you know, they wash their scrub and then they hold their hands up to dry, and, you know, you've seen them in the movies, right? But it's real. I've been in OR and I've seen them do that. And nurses have to do that as well. We wash our eyes because our hands, what's the first thing we touch if we're not thinking about COVID, for example? We touch our face. And how many times are you rubbing, if you have dry eyes, are you touching your eyes with your dirty hands? Sometimes we are. That can help prevent some of these diseases. Like if you keep your eyes clean and healthy, regular eye exams, which I've mentioned, and eating the balanced diet. So this is the last part of the class. We still have a good 10 minutes. I'm going to go through these foods. You're going to see some similar ones to brain health, to overall health, to arthritis relief, to diabetes relief, because there's, I would say, a handful of foods and their vitamins and minerals that is important for good general health. Doesn't matter if you're overweight, underweight, young, old, these are the foods that are good for your eye health. So I would like, if you want to know, I would like you to eat these weekly. if not every day if you can. I eat a handful of nuts every day. Okay, let's not get ahead. Number 1, oily fish. What's an oily fish? Tuna, salmon, trout, mackerel, sardines, herring. Those are your fatty fish. And why are they important to us? Do you know why these are important to us? Sorry, were you going to say something? Sorry, I thought you were. Go ahead, Laura. Sorry, I thought somebody was going to speak.
The oil is
The
what's
oils.
important.
Yes, it's the rich omega-3s. We call it omega-3s for short, but it's omega-3s three fatty acids. You've heard me talk about it in all of my classes. Those are the fatty acids that we require. It's mandatory to survive. If you don't get omega-3s, you don't survive. You need it for body processes in your body. So you get it mostly from these oily fishes. You'll see we'll get it from somewhere else as well, but that's why I say try to eat some fish. I had a white fish last night. It's not an oily fish, so I really didn't get a high thing of omega-3s. I got other things because it was a fish. It was a bassa fish, I think, but it's not considered one of these oily fish. Nuts, and legumes. Now I'm going to double check this. I have to check my screen here because legumes are like beans, but also lentils are good. They can also be high in omega-3s and vitamin E. Our eyes need vitamin E. So walnuts, Brazil nuts, almonds, and lentils. All of those things are great for vitamin E. Don't forget your vitamin E. Seeds. Again, there's great ways to get seeds into our diet. What's one really great way to get seeds into our diet? Anybody have an idea?
Add those seeds to a salad.
Yes, I do that all the time now. I have pumpkin seeds. I think they call them pepita seeds, sunflower seeds, even sesame seeds. And I sprinkle those things into my salad. And I always put walnuts in my salad. I love walnuts. I throw those in my salad all the time. But getting back to seeds, all 3 of these seeds are rich in omega-3s. If you don't really like seeds in your salad or you're not a salad eater, put your chia seeds in a little bit of water, just not even this much water in a jar. Soak it in the fridge. After a while, it comes out like this beautiful, like almost like a pudding. And I scoop that into my smoothies. You can also put dry chia seeds in your smoothie, but if you're going to drink it quickly, they haven't had a chance to swell up. Hopefully they do it inside if you're hydrated. But I like to kind of swell up the chia seeds before I ingest them. I like the texture of it. It's kind of like a pudding. Some people hate it, but I like it. You can actually just take straight chia seeds, put it in a little bit of nut milk or your dairy. I don't really eat dairy, but nut milk, and add a little bit of cocoa and make a chocolate pudding with chia seeds. I've seen the young people, millennials, they walk around with their breakfast jar, and they, it's packed full of chia seeds and nuts, and also you can make like a little breakfast jar. I do that with oats. You soak it overnight. Okay, so there's lots of ways to use your seeds. Citrus foods, really, really important for our eyes. Why? Because of the vitamin C from our lemons, oranges, grapefruits. There's other things that have vitamin C in them as well, but these are like the citrus definitely has the vitamin C. So I don't know if you live in Florida. I mean, I suppose you get beautiful oranges all the time, fresh oranges. But if you go to the grocery store, I've noticed that like organic oranges are not that expensive. You can buy them in like little bags of when they're in season. Look for organic if you can, and enjoy an orange a day. Why not? Our eyes will love it. Leafy green vegetables. Very, very important. Our spinaches, our kales, our collard greens, easy to grow. Did you know how easy it is to grow kale, even in the winter? Most places you can grow kale all year round. And it's fairly inexpensive to buy stuff like that. I take my kale, I rip it, I wash it, I rip it into pieces, I take the veins out, I massage olive oil into my kale, I add a little bit of salt, and I throw it in the lowest temperature I can in the oven. Or if you have an air fryer, you can stick it in the air fryer, and it will crisp it up and make you a whole big bag of kale chips that are really, really delicious. Make sure you add a bit of salt to them, and you could just get a whole bunch of kale in one sitting.
I got a question. How long do you put on your greens, how long do you put them in the air fryer? And what temperature?
Yeah, I tried it with, okay, so I filled my whole air fryer up to like here because I took the whole head of kale, and I'm just a newbie to the air fryer world because I just bought it like a month ago. I think I set it at around, I had it quite high actually. It was like at 360, 370. And what I did is I set the timer for 10 minutes. And after a couple of minutes, I kept opening it and shaking it, putting it back in. But I did massage in the olive oil into it and then put the salt on it. But I'm telling you, I made it too crispy the first time. I didn't have to do it as long. So easy. And if you don't have an air fryer, just put your oven probably can go as low as 170 unless you have a fancy oven that can go to dehydration level. Throw it in the oven, peer through the window, open the oven, go like this, mix it up again, throw it back in until it starts to get crispy. And it's so delicious. Very delicious.
Yeah, I'm just going to make some. I've heard a lot about that. Thank you.
Yeah. Oh, it's so easy and it's really delicious. Kids even like it. Grandkids will even like it.
Can you do that with spinach?
I have not heard of anybody doing it with spinach. So I'm not sure if spinach will get like that, but kale, absolutely, kale works. Number 6, carrots. Haven't we heard about carrots being good for our eyes? Nowadays, you can buy carrots that are already done. You know, there's something that they put on those carrots that is not the best for us, but you know, in a pinch is better than no carrot. But I buy my bunch of carrots that I have to peel first. I cut them up, you put them in the fridge in a little bit of water, and the carrots are there ready for you to eat. High in vitamin A and the beta carotene, really, really important. My next favorite has become my favorite is sweet potatoes.
Eat your damn kale!
Oh, sorry, somebody is, okay, so sweet potatoes. Does anybody like sweet potatoes? Yeah, I'm big on sweet potatoes. I love them. I really, you know, so I'm not eating bread right now. I'm not eating flour. So it's my husband's birthday today, by the way. So I'm going to make a pie, like a quiche with, because we're certain things we're not eating, but I take the sweet potato, slice it really thin, and then you oil up your little pie plate, and then you layer the sweet potato in the pot, like a pie, like make it like the shell. Do you know what I'm saying? And then that's the shell. So you're not using flour. And then you can mix in vegetables and do up your egg and pour it into that and bake it. And it'll come out like a pie. And the pie shell is the sweet potato. Oh, it's so good. So I have a recipe right here. I'm going to make that later today. Okay. Beef is rich in zinc. That's why that's important. We have eggs that are high in lutein and zeaxanthin. It's hard to say. Good sources of vitamin C, E, and zinc. So zinc is important for our eyes. And then lastly, number 10, if anybody here has dry eyes, have you checked to see if you're dehydrated or not? We forget that just drinking good old sipping our water every day is great. Yes, you can use your convection oven as well. Yep, for making things. Granola made with molasses. Yeah, I do all that. I call it my test kitchen, actually. It's me as a nutritionist. I love testing and making new things. So water. How many glasses of water do we need? Around 6 to 8 glasses a day. You keep that up every day. How big are these glasses? How big are you? If you're a petite, smaller person, I learned this from somebody. It's the easiest way to think of it. Have smaller glasses. 6 to 8 glasses. If you're a bigger person, like I'm tall, I'm 5'9", I'm medium boned. There's a way to test what size bones you have, by the way. I'll tell you that to you in one sec. I drink more water. So I use this is a 16-ounce cup mason jar. I try to drink a bunch of these in a day.
A bunch.
I want to just say, so we're at the summary. So I want to just tell you, if you're curious about, you know, when they say, oh, I'm small boned, or most people say I'm large, I'm big boned, because, you know, maybe how much they weigh. I mean, it's not really a big thing, but you know how you test to see what size bones structure you have? And this is funny because my husband is small boned compared to me. And I said, oh, okay, I guess when we're skeletons, my skeleton will be bigger than yours. It's a joke. I was on the higher end. So you have to look up the millimeters because I can't remember what the millimeter amount is. But you take your elbow, feel your elbow, feel the outside of your elbow. You feel the bone on the outside of the elbow, and then take your thumb and feel the bone on the other side. See that distance between here and here?
Oh, that feels good.
That distance between there, if you like, I have those calipers because we're doing like a training thing, so we're testing how we're improving. But if you measure the distance between those two bones of your elbow, will tell you whether, and then there's a you have to Google it. It'll be if it's between this millimeters to this millimeters, you're small boned, medium boned, or large boned. And I was on the higher end of the medium bone, so I said, oh, that's why I weigh what I weigh.
Definitely got thick bones, my God.
Yeah, I mean, it's interesting, isn't it? It's interesting. So anyways, thank you so much for being here. That was just a little side tip to give you about measuring to see if you're small boned or bigger boned. But I was surprised because my husband actually is smaller bone compared to me. We've learned how our eyes change. We've learned the top 4 diseases that are common, can be common. We learned seven ways to improve our eye health and these 10 foods. And you are going to get that at the end of class. I'm going to send an email. Thank you, Arthur. That's
Can I
lovely.
deep fry, Ken?
And sorry, are you saying something to us, Leon?
Yes, can I deep fry the kale?
Deep fry.
The kale.
The kale. You don't need to. That's the whole point. You don't have to put all this oil on it. I would just massage the oil into it, like tear it. And the best tip I can tell you about kale is take that inner seam out, because that you can't chew it, and it's really, and then you won't like your kale chips. So even though it seems very thin, just take the inner. When you rip it, you'll see how it stays together. Just leave those inner seam of the kale out because it's hard to chew. So arthritis class is a big winner. I've had, it's been selling out. So try and book the arthritis relief class early if you can. I'm going to send out an email. You're going to get a feedback form. I love it if you could fill it out and tell me, how you are enjoying this class, what you'd like to see included, added in, or taken out. And please, if you'd like a recording, send it to help@getsetup.io. You can suggest classes, even in your feedback.
Nipples.
You can request like what class you'd like to see on the schedule. So that is the end of the class. I hope that you're all feeling good.
My nipples feel good for sure.
Excellent. Veronica, yes, when you get the recording, you get the whole entire class. So if you came a little bit late, that's fine. No problem. You'll get it. Cindy, do you have a question?
My question is about nipples.
So thank you very much, everybody, for being here.
Nipples.
I'm going to say goodbye to everybody now.
Thank you.
Bye, everyone.